Good morning, everyone. Ohayo gozaimasu. Good evening for Professor Cortino. Today, we are going to have our 50th APAN Telemedicine event. For those who are just joining us, APAN is Asia Pacific Advanced Network, and we are a network who collaborate and exchange information, exchange expertise in medical views for better patient healthcare using advanced communication and information technology. So this is our regular event, and we also have our special dental session. And today our topic is dental research during the pandemic. How could it be possible? So in the next 90 minutes, we will have several distinguished speakers. Professor Cortino Sukocho from University of Illinois at Chicago. Please say hello. And Dr. Dini Setyowati and Dr. Taufan Bramantoro from Faculty of Dental Medicine, University of Erlangga. Please say hello.
Hello. Hello. Good morning.
And Professor Endang Winiati Bahtiar from Faculty of Dentistry, Universitas Indonesia. Hello, Prof. And Dr. Tajiri Shiho from Kyushu University, Fukuoka.
Good morning.
Good morning. So we will discuss how could it be possible to still do dental research during this pandemic situation. I hope all of you viewers have a useful session, and at the end we will have a question and answer session. So for the first speaker, I will ask Professor Cortino Sukocho to share his screen and present for the next 15 to 20 minutes.
Okay. Good morning, everyone in Asia. Thank you for the invite. Thank you for Dr. Melissa and Dr. Aqsa for inviting me to participate in this event. Let me share my presentation first. Okay, where is my presentation? One second. Okay, everything okay here? Can you see? Yes?
Yes, we can see, Prof.
Okay. All right, so I have 15 minutes to talk about how did we start our research at school and also at the university. So so basically, our school opened for full action is I believe is starting July 1st. Okay, because pre-doctoral open, and then after that the clinic open on July 2 weeks after that, and and then after that, well, during that time also people can start doing their research at the dental school. Okay, so let me share with you how did we do this. All right, so okay, so returning to research. So basically, so the guideline is still the same. Okay, we have to use PPE, everything. Everything is provided, and then in this case is mask. Of course, you have to do mask, and then everyone entering the school has to wear masks. And of course, between researcher, they also have to perform social distancing. So when they perform the experiment or when they do the experiment. Okay, and then the second one, I'm going to talk also about environmental controls, and then lastly about procedural or administrative controls. First, before everyone's, all researchers, before they come back to school to start working, this is a university policy. Everyone has to take the training. Okay, that they have to take the training, something related to COVID, something that related to social distancing, related to PPE, related to chemical lists, blah, blah, blah. So basically, so that we'll refresh the memory on how to do the research, what do you have to do when you use the machine in the central core and so forth. So, and you have to pass this, okay? So at least you have to pass 70%, and then after that, you're gonna get clearance to go back to your lab. It's not only the PI, but everyone that participate in research, the student, the postdoc, everyone has to take these courses. Even the professor, they all have to take it, And then, this is a university guideline. If you think that if you're sick, of course, if you think that you are sick, and then also if you are in contact with somebody who is sick, you have to stay home. Okay, you have to stay home, and then you shouldn't come to work. This is not only for the student in our clinic, but also for for all the researchers. They have to know this. Okay, and if you feel that your the work related risk it's not it's not a good environment and you're afraid of the infection, so you may want to contact people can contact our associate in for research, which is Dr. Lyndon Cooper, and then he can take a look at the problem, and then hopefully he can solve the problem. Okay, so regarding productivity, I think we during this time we have to kind of like we have to make a secondary plan. Okay, we have to change our plan. For example, this is a good time for us to do to write. This is a good time for us to write a lot of grants. We have to put new objectives, and then also we have to put a new timelines. Okay, so that we can achieve our goals. For example, during the past 2-3 months, I couldn't, my student cannot come to the lab. So what we told her is that, so why don't you write a review paper? Okay, why don't you write a review paper about the use of atomic layer deposition in the dental material? Okay, so because the student cannot perform the experiment, in the lab, but they're still able to do some review paper, or even finishing up the previous paper, so that they can be also productive and graduate. And also, there's a lot of guidelines, from the NIH, regarding these situations. It may going to affect the salary, because as you know, when you apply for grants from NIH, of course, you're going to request for salaries or stipend. So, so during this time, you may not be able to work. So it's all the salary going to be adjusted. Okay, it's the same thing. Administrative part 2. So also the school, all the office, everything is going to be becoming online. So if research grant office is also, everything is we do everything online, communications, everything is via online. Okay, so you submit your IRB, everything online. You submit your research proposal through the central office at the university. Everything's everything is online. Okay, all right. Okay, so regarding the PPE, it's almost the same as before. Everyone has to use masks. Okay, so when they perform, so previously, people, I have seen a lot of people when they do pipetting, they usually sometimes they forgot about their mask, but this time you have to use mask, because when you enter the building, you have to use mask. And a lot of people, of course, previously they don't use eyewear for somebody who doesn't use glasses. Okay, well, I believe everyone's we always use gloves when we do research. Okay, but however, if you are working with infectious materials, face shields and gowns, disposable gowns is mandatory to do it in the lab. Okay, so let's talk about a little bit about the way the engineering, how do we control our lab, in terms of the engineering controls. First, when you enter the building, so our school previously had 3 entrances. And now all the faculty, staff, and students, they have to enter through specific entrances, and then the patients coming through the other entrances. Okay, so when you enter the building, they're going to check your temperature, and then of course you have to use masks, and they're going to ask you screening questions, and you have to say no to everyone, to all the questions. If you say yes, you cannot enter the building, so you have to go home and then talk to your doctor. So this one is the one on the left is the entrance for the faculty and the staff. As you can see here, she's gonna take the temperature, and after that, we faculty, staff, and researcher, we have to swipe our card so that they can log in your name also, so they know that you are in the building. Okay, we don't have to log out when we go out, when we go home. Okay, the one on the right side is for patients, so it's completely different entrances for the faculty, staff, and student compared to the patients. So it has been advised that you go directly to your lab. You know, we also have elevators, but you know, it's recommended for you to take the stairs. It's healthy for you, and also, you know, you don't see a lot of people because for elevators, you know, maximum 4 people per elevators. Okay, so it's going to be heavy. So, and also elevators are enclosed spaces that challenge social distancing, as we know. And then also we have to assume that our lab doorknob is contaminated, okay, because a lot of people will touch that. So it is mandatory for you to wash your hands upon entry to the lab. And then the lab, I think every lab now has a sink for hand washing, you know, and then also, you know, everything is hand soap, paper towel, water, alcohol-based sanitizer, you know, everything should be available. Okay, so this is, for example, you know, so there's a sanitizer on the left side here next to the door after you open the door, and then you can disinfect your hands using the sanitizer. And also the one on the right is always, you know, the alcohol-based sanitizer is available everywhere in the building. And then after that, you put your gloves and then you clean your desktop, you know, and then, you know, your working area, your lab, low bench, you know, everything with always sprayed with 70% alcohol. As we know, the virus will be killed. We can kill the virus with 70% ethanol. Okay, so this is kind of like a habit. So before I think we only use 70% ethanol when we work with the bacteria or cells, right? So this, you know, we always spray. But this time, you know, when you do PCR, you always have to spray, make sure, because there's a lot of people going to touch that, you know, this machine. So you always have to wipe it with the 70% alcohol. You know, the lab should be sparkle, should be clean as, you know, as it can be. And then also you have to, on your bench work, okay? So you have to reduce or eliminate clutter. Okay, so try to eliminate the instruments, paper, boxes, something that unnecessary, you know, on your bench. Okay, so your bench, you know, should be only the one that you're going to work during that time. And again, you have to wipe it with the 70% ethanol or spray with 70% again and again and again. Okay, so here in the US, we have to follow this also guidelines. You know, during this pandemic, so everyone has to do social distancing, try to work in a shift, and then also downsizing of operations. So for example, if you try to split your research team into 2 groups, for example, one, you know, working in the morning and one working in the afternoon, or one working on Monday and the other one working on Tuesday, you know, so that, you know, just in case if one, and then you always have to try to keep your groups to be the same all the time, okay? Just in case if one is contaminated, one is got COVID, we know who's going to be, you know, who's the partner, and then, you know, everyone has to has to be quarantined, you know, together. And also try to reduce, discourage workers from using other workers' phones, desks. You know, before, you know, there's also a communal phone. We try to, you know, try not to use it that often. If you use it, of course, after you use it, you always, you know, clean after yourself. Okay. And also the equipment. You know, before we like to share the pipette. Now, you know, everyone should have their own pipette as possible. And also, you should not eat. This is usually, you know, people when they eat, you know, during lunch break, they go and then they eat in the lab. You should not do that. Even if you have a place to eat next to your lab, you know, and you have to make sure that, you know, that you still do not, you still may practice social distancing if you have a lot of, you know, a lot of colleagues there. And then if you must eat or drink, please remove your PPE, wash your hand, exit the lab, and then disinfect where you are sitting. Again, wash your hand before eating. Okay, so just kind of like, you know, you have to be anal a little bit. And then also, you know, try to do not, maybe if you are using like a hood, you know, try to like a schedule. Okay, from 8 to 9, you know, it's going to be used by A. From 9 to 10 is going to be used by B. So try to make a schedule, and then everyone has to be done 10 minutes before the deadline. Okay, so that, you know, so that there won't be a lot of people, you know, waiting for you. Okay, and also keep the teams separated, both spatially and temporally during this high risk period of time. So again, as I mentioned before, try to, group your research team. Maybe one come in on Monday and Wednesday and Friday, the other one come on Tuesday, Wednesday, and maybe weekend. Okay, a lot of people, they like to work on the weekend because that's when they don't see a lot of people. This is another interesting part, when you receive a package, from here, we receive a lot of package from Fisher, from Amazon. So it's going to be delivered to your lab door. So usually when it's not perishable, when it's not something that you have to put it in the freezer right away, leave it there for 48, 72 hours. Okay, because why? Because it's usually, the study have shown that the virus will, will be gone after either 48 or 72 hours, depending on what kind of surface they are touching. Okay. Otherwise, of course, you can spray with this. Always spray with the 70% alcohol. Okay. For example, if you receive medium or FBS, before you put it in the fridge, always spray it. Okay. And also for the collaboration for the meeting, you talk to everything is they recommend to do everything online. Zoom meeting, WebEx meeting, whatever it is, and online lab meetings also, everything should be done online. Although, you only have like 4 or 5 people in your lab, but try to do everything online. Okay, so don't try to sit in the group in the small spaces. And also plan when you leave or close your lab space for the day. You need to plan time to accomplish the important tasks, and you always have to clean your bench, clean your desktop, clean all the materials that you touched before, remove your gloves and wash your hands, and then exit the building directly. Okay, don't talk to people. So you just in, you are out, you're done, you're working, and then you go home. Okay, and then after that, of course, you always have to practice social distancing. Our Office of Research from the university is always is also open for business from 8 to 5. So if you need to submit your proposal, you have to take care of your budget. Everything can be done online. So either you can make a phone call, or you can have a chat, or you can have you can send an email. The same thing here when you order supplies and budgeting, because due to this COVID, you have to make sure that you know the timeline. Okay, when you order, because a lot of people you cannot really see them, so you have to submit your budget or your what to order to your secretary, but you have to communicate with them online. Okay, so it's going to take time. What happens if somebody is sick? If somebody is sick, so you have to contact the university health service. And then there's a protocol to do that. Okay, so they have to follow the protocol. And this is all the information. So we all have the links, in the lab. What happened if you have this, if you have that. So everything can be addressed. And then for the research reboot, basically you have to try to make a plan. Okay, so you have to think about what is the alternative solution, and then you have to delete factors that that add stress to your group, to your lab, to yourself. Okay, so because this is a very challenging idea, so everyone has to work each other, has to work as a group and try to help each other. Okay, so so our colleagues actually we got inspected by the UIC Environmental Health and Safety Office, and then so I'm just going to touch the one on the lower left because that's the research meeting. As you can see here, a lot of people, they are very close to each other, and we got kind of like a red flag from the another office. So this is something that you want to make sure that when you have a meeting, you also you need to have a social distancing as well. Okay, and finally, this is my email and this is my WhatsApp number. If you have any questions, please, you are welcome to contact me directly. Thank you so much.
Thank you so much, Professor Cortino. For those who are viewing from YouTube, you can post your questions in the comment area, and we will read your questions in this Zoom session, and the speaker will answer it. Is there any questions yet, Mr. Tunggul?
Not yet. Not yet.
Not yet. Okay. So we still have time here. Can I ask several questions to Professor Cortino?
Oh, of course.
Okay, in terms of research topic, is your lab concentrate on research related to COVID-19 disease, or just like business as usual, and you just have to make some adjustment in terms of budgets and research plan?
Okay, good question. So the first one is we do have a clinical study related to oral microbiome. So we collected the samples from the human samples, okay? And because the IRB has been approved a long time ago before the COVID, so I asked the Office of Research and they say there's no problem. Okay, so we can just continue, just do a regular, like the way you treat the patients. Okay, so like the way you treat the patient, our patients in the clinic. We also have one for extra oral prosthesis. That one is also the same thing, just like the way, you have to do screening when the patients come in the clinic. Of course, you have to do screening, asking a lot of questions, whether you have high temperature, blah, 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 take the temperature. Basically you treat the patients like the cohort, like the way you treat your patients. Okay, we do have a lot of we are submitting one grant about how to modify the N95 mask, related to COVID. Yes, and we do also educational study. Well, that one is not really COVID related, but it also, I don't think IRB, there's no problem with the IRB too. So if you are asking me about the ethical issue, IRB always think that everything is okay, as probably what you need to do, you just want to add an extra protocol about how to deal with the COVID situations. Okay, for example, one study we are doing a study about VR, virtual reality. So every time another person use that goggle, you have to wipe it after use. Okay, so that's something, that extra information that you need to disclose, when you ask for the IRB approval.
Okay. And for those who are regularly working in the laboratory, especially those who take human samples, do you have some procedure like regular swab or rapid test for them?
No, because even for the patients, no. For the faculty, no, also. Because, the question is, who's going to pay for it, right? Who's going to pay? Who's going to pay for the patient? Who's going to pay for the faculty, or for the test? Because for the test, is you pay from from your own pocket is $200. Okay, so I don't know if you can. And the problem is that you swab now, it's negative, doesn't mean that a week later you're gonna be negative also. So I think it's very hard if you want to do swab. So what we can do, we just try to the way we treat, like the way you treat the patients. Okay, so just do the clinical screening, teledentistry. You ask the patients, you ask your cohort before they come whether they are sick, and then there's going to be the second screening from before when they enter the building, and then lastly when you see them in the clinic, there's going to be the third screening. Okay, so just
follow the protocol.
Yeah, just following the protocol.
Okay, thank you.
Okay.
Is there any questions from the other speakers? No? Do we have any questions from YouTube? Not yet? Perhaps it's still very early here. Okay, thank you, Professor Cortino. For those who have more questions, you can send the questions through his email on his last slides, and we can discuss more later. So continue to this next speaker. We will have speaker from University of Erlangga, Dr. Dini and Dr. Taufan. So you will have a joint session, right?
Yes.
Okay.
Let me share my PowerPoint first.
Okay.
Is it clear? Yes. Okay. Good morning, everyone. Let me just shortly introduce myself. My name is Dini. I'm a lecturer in Dental Public Health Department in Faculty of Dental Medicine, Universitas Erlangga, Surabaya, Indonesia. Today, I would like to share how we keep going with our research during the COVID-19 pandemic. Because we are from Dental Public Health Department, maybe our research is a bit different from what Dr. Cortino present before. It's in the lab, but we usually have to have a direct contact with the respondents to do a research. For today's presentation, in the first 10 minutes, I will present about the alternative for doing research in dental public health. And then the last 5 minutes, Dr. Taufan will present about GIS research for secondary data analysis. Okay, since March 2020, when our government decided to have social distancing, it will have a great impact for us, particularly for research in dental public health, because we can't have a direct contact with the respondent. So we have to think what alternatives that we can do to keep going with data collection and keep going with the research. So the first thing that come in our mind that we can use secondary data analysis. It means that we use the existing data collected by others, and we try to reanalyze something or variables that have not been analyzed before by the owner of the data. So it means we have to ask permission from the owner of the data, and we have to look carefully of the data, and we have to think what variables that can be analyzed, and we can produce something new from the existing data. And the source of data that we can use for secondary data analysis, we can have from statistical data from our government, from NGO, or even if we have access for data in the UN, or we can also try to access the data from National Survey Risk Organization. And it's common in Indonesia if we just access the data from basic health research and we reanalyze the data. And from this source, we already have one publication. It's related to dental health utilization. And also we can access data from census data, or we can also approach our college that may have a large amount of data that we can use to reanalyze, produce a new idea of the research. And the second thing that we can do in the COVID-19 pandemic, if we do literature review. So in the literature review, we document the state of the art. It means that we have to show, we have to present what have been already known or what have been already done about a particular topic in the field of study. Literature review is considered as research because in literature review usually have a novelty, something new that may have a contribution to our current knowledge. And then in literature review, we can choose whether we do narrative review, scoping review, systematic review, with or without meta-analysis, or even meta-regression. It depends on the purpose of the review. But today I'm not gonna explain in detail the difference between the review because we have just a strict time limit. So yeah, I just can say that each type of review, they have a different purpose. And the general objective of the review is we have to search or survey the literature about a particular topic in the field, our field of study, and then we have to make a summary of the literature that we have got, and then we critically analyze the information we have gathered to produce synthesize something new. That it's not just about summary, but we just give a critical analysis in our review, so we can have a novelty that can have a good contribution to our knowledge. From literature review itself, we also have several articles that have been published in the international journal as well. And the third alternative that we can do is a survey. As we know, for dental public health researcher, we commonly use survey as a method to collect the data. But the problem for us to do survey is usually if we distribute questionnaire, we have to have a direct contact with the respondent and we distribute to them. But now because we have to do social distancing and we have to do all online, so we have to think the method to distribute the questionnaire. The first thing we think that maybe we can distribute questionnaire by sending the questionnaire through postal mail, but then we realized that it will spend a lot of money to send at least 100 questionnaire or more. It will spend a lot of money. So we think about electronic survey, because electronic survey we can gather a large scale of data collection. For electronic survey itself, there are two forms. We can use email survey or we can use web-based survey. If we decide to use email survey, it means that our questionnaire may be embedded in our email message, or we include our questionnaire as a file attachment in our email message. But I personally prefer to use web-based survey, because for web-based survey we have to design and create our questionnaire in advance using several application or software that have been available and free access. Here is several application or software that we can use to create or design our questionnaire for survey. The common application or software that we use is Google Form and SurveyMonkey, and it's free if you want to use the application to design and create a questionnaire. And then after we design and create the questionnaire using these applications, we usually will get link. The link we can share to the respondents. We distribute the link in social media. We can use Twitter, Instagram, Facebook, or just using WhatsApp group or Line group or other platform that we can share the link. And also we work together with community health center, because in community health center usually we have a health cadre, a person who is voluntary help community health center to run a health program. So we have experience. We work together with community health center and the health cadre, and the health cadre help us to distribute the questionnaire to a group of people. It's the target at that time is for elder people, and we can get around 150 response using health cadre that help us to distribute the questionnaire via WhatsApp group. Excuse me. And we also run an intervention program online. So after we do a research and we have a finding, we know what's the problem, and we try to create a solution to solve the problem. And we have to design an intervention program that we can do online. So the first one, we have to create or design a media that we can share online. We use electronic book, and this is some examples of our electronic book. The first electronic book here is about the impact of smoking in oral health. And then here is an example of how to about dental care for elderly people, and this is related to COVID-19 and diabetic patients. And also we try to design or create another media for intervention program using electronic educational oral health education program using video. So this is educational video. And this one is about chatting video or video chat. So we like watch a video, but in that video, we read chatting, but the content of the chat is around oral health education. In this chatting video, the content is about the motivation to just stop smoking and show how smoking has an adverse health effect for people, including in oral health. And then the last approach that we also carry out is about qualitative research. Maybe qualitative research is not as common as quantitative research in dental research, but if we open our mind that quantitative research is not the only approach for dental research, we also need qualitative research to enhance our knowledge about the problem, about the issue that we already face in dental health. If quantitative research is related to number, the qualitative research is related to words. Quantitative research is useful to show the prevalence, the frequency, the distribution, the causality, the relationship between variables, the difference between variables. But the quantitative research can't answer the question why and how. To answer the question why and how, we need to have a good understanding, a better understanding about the issue. To get a better understanding, we have to have an interview to the participant, to the people who experience the issue or the phenomena. So in qualitative research, we interview participants. It's usually we have interview around half an hour until an hour, and then the participant will let participant to give their voice, their experience, share the experience, what they think, why they perform particular behavior, and so on. So the purpose of the qualitative research is to gain a deep knowledge about a topic of our interest. There are a lot of research methods for qualitative approach, but for the current pandemic situation, I only do in-depth interview and focus group. If in traditional we have to face-to-face interview, we have direct contact with the participants, but in the pandemic situation, we can do interview online. We can use a video call, WhatsApp video call, line video call, or we can use Zoom or WebEx like we do today. In-depth interview, it means that we interview one-on-one basis. But focus group, we interview a group of people, usually ideally consists of 5 to 8 people. And we can do the interview online. This is our current qualitative research project. One of them we already finished 2 weeks ago, and now we are preparing a manuscript for publication. It's about smoking hazard in oral health, and the finding is quite interesting because smokers actually doesn't know or doesn't have any idea or not aware that smoking has a great impact on oral health, about oral cancer. They're only concerned about the cardiovascular disease, lung cancer, and so on, but they never know about the impact of smoking in oral health. And for the 2 projects, we still collecting the data. It's about the use of miswak among Muslim community as alternative for toothbrushing. And also it's about the perception of dental students who now enroll in a professions program about the transmission of COVID-19 during dental treatment. Because as we know, if we are a dentist, we are aware about that. But how about our students that will be a dentist soon? Are they aware or not? What's their perception about the transmission of COVID-19 in dental treatment? Okay, that's the end of my presentation. In the next 5 minutes, maybe Dr. Taufan will share about GIS research for secondary data analysis. Thank you.
Thank you, Dr. Dini. Perhaps we continue to Dr. Taufan first and then question and answer after that.
And Dr. Dini, not only a singer that can do a duet, also a presenter presenter also can do the duet also. Okay, I will share the presentation. At this moment, I will have a topic that, about the dental public health research in the pandemics, especially utilizing large-scale secondary data survey sources and geographic information system approach. So I'm Tovan Wantoro, and I'm a lecturer in Dental Public Health Department, Faculty of Dental Medicine, Universitas Airlangga, Indonesia. There is a big question. Could we do a valuable large-scale dental public health research in the pandemic? So this is maybe a $1 million question. And the answer is yes. We could utilize large-scale secondary data survey sources. And as explained in the previous presentation with Dr. Dini, there are a lot of secondary data sources, and there can be locally, regionally, or maybe internationally. Locally, usually related with the data in specific institution, like in the research center, hospital, and also internal database. And as regionally, usually related with national survey in every country that held by government institution. And internationally, it could help by international formal institution and also an NGO. And one example of the international secondary data sources is IFLS. And there are some limits in the process of obtaining primary data in particular conditions. Thus, the utilization of secondary data becomes the most possible option. And the point is not only an ordinary secondary data, otherwise we could utilize a large-scale secondary data. This is one of the example is the IFLS, the Indonesia Family Lab Survey. IFLS is conducted by RAN in collaboration with Indonesian University, University of Indonesia, and also Gadjah Mada University. And recently has already had 5 waves since 1993 until 2014. The sample is representative about 83% of the Indonesian population and contain over 30,000 individuals living in 13 of 27 provinces in the country. And this is a very interesting sources. And we have some paper publication. One of the publication is about the depression symptom and recurrent aphthous stomatitis. It's using Indonesia Family Lab Survey, and we analyze a total of 29,000 participants. So this very big number of samples. And also this is the other publication related with factors affecting dental service utilization in Indonesia, a population-based multi-level analysis, collaboration with the Hungarian University, using the Indonesian Family Survey also, and include a total sample of 16,000 adults aged 5 years or older in our study. Okay, and then other sources is the DHS, Demographic and Health Surveys. This is also the interesting sources related with secondary data analysis. Content of a lot of data and information. Actually, I and my team are still learning about these sources. Otherwise, my friend in nursing faculty, Ferry Effendi, already has a lot of experience in DHS data analysis. There are some of his publication. This is for the example. So he have analyzed about the woman empowerment and the use of antenatal care service, analysis demographic health survey in 5 Southeast Asian countries. So it can be done only using the secondary data analysis in the HS source. And then this is the other publication using 11 over than 10,000 observation, combined data from the Indonesian demographical survey of 2012 and 2017. So this is the example when we optimize or utilize the right scale secondary data survey source. And what next? The next is geospatial analysis for dental public health. In the previous explanation, we could analyze a large-scale secondary data survey using raw data access from the organizer. Next, could we do a large-scale secondary data analysis without raw data? The answer is yes. We can utilize geographic information system approach. So this is the explanation, the short explanation about the geographic information system approach. So for a better understanding of the oral health disease process, it becomes interesting to explore the relationship between geographic space and community health. So geographic space is understood as an active environment. And the detailed analysis of the pattern, it will be a very nice information when we do the analysis. So this is the step. Okay, I will maybe I'm not explain it to detail. And this is the example. This is the example of information from 2018 Indonesian Basic Health Research Report, data by province. So we have this information from the reports. We don't have, maybe we don't have the raw data. Maybe if we want to get the raw data, we must have permission to the Health of Ministry of Indonesia. But we have this in the reports. So we can analyze using this data, using this geographic information system approach. Yes, this is the process. We combine it with the Indonesian Health Facility Research and become this. I'm sorry, this is a very small picture, but I just give the preview about how to optimize the geographic information system approach. So in this approach, we can combine a lot of information with the area-based analysis. So we can know which the province that need more attention based on the combination between healthcare facility and oral health condition. We have the poor healthcare facility or maybe the best healthcare facility and other information, and we can analyze it using the published information, the only published information. We can analyze it without the raw data, but we can analyze it with using the information that has already published in public. Okay, that's all from me. Thank you, Dr. Melissa.
Thank you very much, Dr. Dini and Dr. Tafan. It's a very interesting topic to cover. Is there any questions from the YouTube viewers? Do we have any questions, Mr. Tunggul? Okay, perhaps he's checking it now. Okay. Is there any questions from the other speakers? Actually, it's very interesting because my field is also community dentistry, so this is quite interesting. In terms of research topics, do you encourage your students, the undergraduate and the postgraduate, to use the secondary data or use the primary data by electronic surveys? Which one do you more recommend to them?
For dental students, we usually encourage them to do the online survey and also qualitative research rather than secondary data analysis, because the problem with the secondary data analysis is the access of the secondary data itself.
Yes.
So if we have access, whether use the government data or maybe we as the supervisor have our data, and it can be reanalyzed by the student, we will let them do secondary data analysis. But at the moment, they only do the literature review and online survey and qualitative research.
Okay, because it takes time to get the permission to get the secondary data.
Yeah. Some data is expensive to buy the secondary data.
Yes.
So we have to have a budget or grant to get access to buy the data from the government or the organization that own the data.
Yes, and sometimes it doesn't fit with the timeline of their graduation.
Yes.
Okay, we have one question from the YouTube viewer, Dr. Vidya Putri. Thanks for the presentation, Dr. Taufan. My interest is spatial epidemiology. Did you have any difficulties using secondary data, especially from government data? And how about the validity of the spatial data?
Yes, thank you, Dr. Vidya Putri. So actually, yes, we have not difficulty, but there are some procedure when we want to use the secondary data from the government. So we have to propose the proposal first, and then get the review from the and assessment from the staff in the health ministry, and we have the procedure of that. And actually, I and my team not have the data yet. We still have to propose the data, but we have done. We have still in progress to analyze using the special approach, using the data that have already published as in public. So we have analyzed based on the province area. Now we cannot analyze it more detailed or maybe specific area until the district or maybe or city in city. But we try to use the published information that based on the province data. So we make the analysis, special analysis in the province-based data. Okay.
Okay. And how do you explain or when you write the publication about the validity of the spatial data, the geospatial data?
Yes, I think the validity is more clearly when we use the secondary data, because the secondary data is usually held by the government institution or maybe the NGO that has already have a lot of process before they do the research. And I think the validity data is good, I think, because it already has a lot of process before it's held by the institution.
I would like to add something regarding the validity of the data from the government data, from the secondary data from government. I think we can just say we refer to the government publication about that data. Usually, when they publish the finding of the data, they will explain about the validity and so on. And then when we want to submit a publication, a manuscript, when we say about the validity, we can refer to the government publication.
Yes, I agree with Dr. Dini. So usually in the government documents, they explain how they take the primary data and also the limitation on how they do it. So it's quite clear how to explain and the validity when you write the report or write the publication using the government data. Thank you very much for your question, Dr. Vidya. Do we have any other questions from YouTube? Actually, the IFLS, the Indonesian Family Life Survey data is very big, and not so many publications come out of the data, and actually we can use it very well for a lot of publication, right?
Actually,
So,
for the dental public health, I think for the oral health, there are still not too much.
yeah, it's not so much for the oral health data, but for the background of socio-demographic and health situation is very good, the IFLS.
Yeah.
Okay, thank you very much, Dr. Dini and Dr. Taufan. It's a very interesting presentation. So we will move forward to the next speaker, Professor Endang Winiyanti Bakhtiar from Faculty of Dentistry, Universitas Indonesia.
Thank you very much, Dr. Melissa. Thank you for inviting me to share about the research in Faculty of Dentistry, Universitas Indonesia. Let me share my presentation. Okay. The title of my presentation here is the research in Faculty of Dentistry during the pandemic COVID-19. Maybe I would explain about the outline of my presentation. What is a COVID-19 and the role of oral cavity in the transmission and pathogenicity of SARS-CoV-2, and research in the faculty on the pandemic COVID-19 and how could it be possible. So first, a brief about COVID-19. As we know, the coronavirus disease, I say COVID-19, this is worldwide spread during March 2020, and the WHO state this is a pandemic worldwide. The SARS-CoV-2 is the causative agent of COVID-19. It belongs to the family virus severe acute respiratory syndrome. How about the transmission? The transmission for COVID-19 is from, the hypothesis is from animal to human, but the modus is unclear yet. So the important thing in the field of dentistry is here that the oral mucosa as a part of the entry of SARS-CoV-2. Why? Because SARS-CoV-2 spike protein mediates binding to the virus with its receptor called angiotensin-converting enzyme 2 or ACE2, and promotes the fusion between the viral and host cell membrane and entry to the host cell. Here we can see the ACE receptor here. ACE receptor, and then this is spike protein, and they can bind before enter to the host cell. So most important again, the transmission of SARS-CoV-2 is mediated by our oral cavity, because oral cavity had a lot of viral load, SARS-CoV-2, that been associated with the severity of COVID-19. During the first 10 days, the virus mainly accumulates at the nasal, oral, and pharyngeal area. And the number of ACE2 receptor is greater in the salivary gland as compared with the lung and other epithelial. And this is our concern is about the salivary droplet represent the most relevant transmission route. So what is the vulnerable population here? Is anyone who is immunocompromised or immunodeficiency, an older adult, at risk due to underlying medical condition such as heart disease, hypertension, diabetes, and chronic respiratory disease or cancer, or at risk due to a compromised immune system from the medical condition or treatment such as a chemotherapy. Another social aspect that may be vulnerable population is difficulty reading, speaking, understanding, or communicating, difficulty assessing medical care or health advice, difficulty doing preventive activity like frequent hand washing, covering cough and sneeze, ongoing specialized medical care on specific medical supplies, ongoing supervision needs or support for maintaining independence, and difficulty accessing transportation, economic barriers, or unstable employment or inflexible working condition. A social or demographic isolation as well, like a remote and isolated community. So how about the research in our faculty? Our strategy here in Universitas Indonesia have a policy that in March, beginning of March, Universitas Indonesia established a task force for planning, implementing, monitoring the protocol for the activity during the pandemic COVID-19. This is a similar, I think, with the presentation of the Professor Cortino in Illinois. So this is everything about the policy of activity during the pandemic of COVID-19 in Universitas Indonesia. And then in June 2020, the faculty launched the guided book related to the activity in education, research, and community engagement. And the mid of June, we have reopened the research activity in the lab, and we released the laboratory regulation for research during the pandemic of COVID-19. Here is the book. This is launched by the Professor Board of the Faculty Dentistry Universitas Indonesia. This consists of about education, research, and how to do community engagement in the faculty. And we had launched this book through the webinar, Zoom webinar. It is the contributor of the book guidance, all of our professor board in Faculty of Dentistry, Universitas Indonesia. So how about the research in the book? There's in the chapter 2 that COVID-19 pandemic and implication and dental research guidelines in Indonesia. A brief about this book consists of the limitation and research opportunities in the during the pandemic COVID-19 in dentistry, and the management of biosafety sample in dentistry research laboratory during the COVID-19. Briefly, for operating the laboratory, we need biosafety level 2 facilities for research activity that use human sample. If not having BSL2, we have maybe some colleague from Airlangga University has already present about online survey, the meta-analysis, or research review article. But in the field of biomolecular, we can still conduct research by bioinformatics or in silico or molecular docking. But also we can conduct the research by in vivo in the animal or in vitro by cell line culture. And another alternative is collaboration with the lab that have BSL2 for DNA, RNA isolation from human specimen. So basically, we follow the WHO guideline for research involving collecting of specimen of human origin. Here's the book that we have released in the mid of June before we open the laboratory. The book is about the regulation of research activity in the lab. Yeah, we have 2 labs. Here's example from oral biology lab. Another lab is dental material laboratory. So we have a guidance for regulation during the pandemic COVID-19. In brief, we advise the researcher, as we don't have a biosafety level 2 facility, we stop collecting sample, and the sample since the January 2020, we couldn't use. We have assumed that maybe this already carrier of SARS-CoV-2 virus. So we aware with this condition, and both saliva, gingival clavicular dental plaque or mucosa until laboratory facility are available for BSL2 standard. So we have exception here. The researchers still can conduct research with the human sample if the sample had confirmed a negative SARS-CoV-2 through PCR examination. This is the responsibility for the researcher to do this examination. So we need to set up and prepare laboratory facility with BSL2 facility for research laboratory. So like in Illinois that Professor Cortino already presented, that in our laboratory here, there are many restrictions for doing research. So first, the researcher and laboratory assistant who are allowed to work in the lab are those is under 50 years old and in a good health. So because maybe for the older people, they are very vulnerable to get infection of SARS-CoV-2 virus. So during the implementation research in the lab, they must conduct the laboratory health and safety standard. And first, before entrance to the laboratory, they must pass the health screening procedure in the before entering to the laboratory. So we have reduced the number of researchers. This is only 30% of lab capacity allowed of number researcher and student, and reduce the working hour in the lab. Next, not allowed to work overtime unless there is something very urgent, and maximum of 3 people, of course, after approved by the lab coordinator. And then the important thing is they need to appoint for scheduling as a task, first by contacting the lab assistant. Here is the illustration, how physical distancing in faculty dentistry laboratory. So from one to another, maybe it's about 2 meters. So only 10 people allowed at any time in the lab. So in the tissue culture room, only 1 person allowed working in the tissue culture room. And here is the system, how we manage the schedule for the student and researcher. So they have first make a booking. This is a Google Sheet. So the lab coordinator will be able to monitor who are in the lab at any time. This is the situation in the lab. This is in the tissue culture room. So like the public health research, we can still do dry lab instead of the wet lab for the biomolecular research. This is some example we can do. So maybe we can do the bioinformatics studies. Yeah, this is the bioinformatics study, or molecular docking to look how the interaction between 2 molecules by computer, by bioinformatic tools. This is the sample how P. gingivalis, the periodontopathic pathogen, interact with our host cell. maybe like in the Erlang University, we use teledentistry. Maybe Dr. Melissa and her team in public health already done this kind of research. Yeah. At the end, this is some concluding remark. The research is still needed to deal with the disease pandemic, and COVID-19 pandemic is, I think this is a lesson learned, and how the direction of our future research. And I can say that research and innovation is a new ideology after the COVID-19 pandemic. And a bit take-home message, please follow the science during the pandemic situation. Thank you very much, Dr. Melissa.
Thank you very much, Professor Endang. Very interesting presentation. Perhaps a slightly different situation with the one Professor Cortino has already described in his presentation. In Indonesia, especially in Jakarta and also East Java, the number of new cases per day of COVID-19 is still very high. So the precautions we take in our oral laboratory is still very, very high. So as Professor Endang already mentioned, only 30% can work inside the closed situation of the laboratory, and a lot of other regulation that we need to obey before we can work inside the laboratory. So do we have any questions from YouTube viewers?
Already, but from
Okay.
the Dr. Taufan.
Okay.
Okay, so one question perhaps to all the speakers, is it possible to use the data source like the one Dr. Taufan mentioned, the IFLS or DHS or the geospatial data, to use not only in the field of community dentistry, but also in other disciplines of dentistry, like basic science?
Thank you, Dr. Nilo.
Yes.
So one of the limitation if we use secondary data is that we must follow their or the organizer variables and research method. So if there are limited variables related with the dentistry topics, so we could not expand our topic. Regarding with IFLS that I have mentioned in my presentation, actually there is very limited variables related with dentistry. Only toothpaste and also ulcer, and then there is very limited variables related with dentistry. But on the other hand, there are a lot of socio-demographics variables and also very detailed. We can know about anything related with social demographic, very detailed. For example, for smoking variables, we can know about how many cigarettes that they smoke and what the brand, and also how they smoke how they smoke and other variables. And also we can know about the grade of the student and also a lot of social demographic and very detailed. But unfortunately for the dentistry is very limited. Hopefully for the next wave, I heard that there will be a next wave. It will be more variable that related with dentistry. Hopefully.
So it depends on which variable you want to do research on.
Yeah, so we must be creative when we use the secondary data. We must expand our knowledge and maybe our creativity to make the relationship to tailor the variables, the variable that we want to analyze more using the
Yes. Okay, thank you, Dr. Taufan. And to Professor Endang, how can we use the secondary data in the field of oral biology? And does Faculty of Dentistry, University of Indonesia have a special research topic tree for COVID-19?
Okay, thank you very much, Dr. Melissa. As I mentioned before, we can use the bioinformatic data, yeah, bioinformatic data from NCBI. Yeah, so we can retrieve the, for example, the gene sequencing data from the database, and we can analyze by bioinformatic tools like a clone manager, Uniport, or something like that. And we can still use the application, the computer bioinformatic tools application. But we need maybe to collaborate with the expert from the Faculty of Medicine that already have the research center about the bioinformatic research topic. And the second question is about, do we have research related to COVID-19? Yeah.
Topic
Okay.
3, yes.
Dr. Lisa Amir had published about the survey of student perception about the online study during the COVID-19 pandemic. This already published in, what is this here? Hang on. In ResearchGate. We can see that the student perspective of classroom and distance learning method during the COVID-19 pandemic in the undergraduate standard dental study program. We can access this free article in the Google Scholar. And the second research, we already submitted the proposal with collaboration with pharmacy faculty and the medical faculty and the biopharma company for developing COVID-19 drug recombinant protein that has been submitted to LPDP, our research brain board in our government. And we are still waiting for the decision until October. That's it, maybe.
So we have several projects ongoing related to this COVID-19 topics. Thank you very much, Professor Enda.
Thank you.
We will move forward to our last speaker, Dr. Tajiri Shiho from Kyushu University. Could you please share your presentation?
Thank you very much, Dr. Melissa.
So Dr. Tajiri's specialization is oral and maxillofacial surgery in the Faculty of Dental Science, Kyushu University.
I am very pleased to have this opportunity to speak today. I am Sjuhada Tajiri, a dentist in Kyushu University Hospital, Japan. My specialty is oral surgery. I'd like to talk about an attempt to online speech therapy for cleft palate patients under COVID-19 pandemic. Due to the pandemic of COVID-19, the Japanese government declared a state of emergency to stay home except for necessary tasks from April 7th to May 25th. Dental treatment is considered to be a high risk for infection. We restricted outpatient treatment and surgeries except for emergency cases such as migraine tumor, trauma, and severe inflammation in our hospital. We also postponed medical appointment for the patient of cleft lip and palate. Cleft lip and palate are birth defects that occur when a baby's lip or mouth don't form properly during pregnancy. Cleft lip is opening upper lip, and cleft palate is opening the roof of the mouth. The treatment of them requires both surgery and long-term follow-up care from a large medical team. The team is considered in oral surgeon as a dentist, doctors, nurses, dental hygienist, and speech therapist. Cleft palate repair surgery is usually done when the patient is around 1.5 years old. The goal of this surgery is that the gap in the roof of the mouth is closed and the muscle and lining of the palate are rearranged. The object of the speech therapy is to improve articulation disorder and verbal dysfunction. For them, discontinuation of speech therapy is not palpable. So we started online speech therapy using Zoom after the government approved a medical consultation by telephone. This is procedure to online speech therapy. We posted an information on our page. First step, dentist or speech therapist call the patient and make appointment. Second step, the patient and their parents fill out application form on web page. Third step, engineer sent email for the patient with Zoom link. We took speech therapy with computer, mobile phone, or tablet. After training, both patient and clinician answer questionnaire to give feedback. A total of 15 online speech therapy we conducted from May 11th to 29th. The subject age was 3 years and 5 months old to 80 years and 2 months old, and average age was 7 years and 5 months old. Most of the cause of speech disorder was cleft palate. We selected patients from the cancer list in April that we consider suitable for online training. Specifically, we target patients who could read letters and pictures and usually concentrate and one speech therapist. Online speech therapy.
せあ、
あせあ、
あそうあ、
あそあ、
ちょっと惜しかった。ベルが見えんかった。あそうあ、
あそあ、
お上手。いさい。
The patient repeated meaningless syllable
ベルペッタンでいこうかな。
speech
さ
therapist, and she confirmed that correct pronunciation was achieved. Speech therapist shows a picture card or a short sentence, and the patient reads a name or letters.
はい、行こうと。お、通気をつけた。上手。じゃあ次行くよ。しがちょっと惜しかった。し。お、そのし。バッチリ。じゃあ次行くよ。お、素晴らしい。じゃあ次。あ、どこが惜しかったと思う？そうそうそう。きちんと。
We also use tools such as straws, pens, and picture books for speech training. For improving laryngeal dysfunction, they were practiced to blow out from the mouth with a straw. They were training lifting the tongue by pushing it with a spoon. This is equipment that patients, dentists, and speech therapists used. The patient used mobile phone most, and there are many iPhone users. All dentists and speech therapists use computers. We not specify what to use, they choose the device that they usually use. This table shows the number of patients and training time by age. At 3 to 12 years old, we tend to extend training time. We use Zoom app. Although 61.8% of patients use Zoom for the first time, 95.2% felt that Zoom was easy to use. The more frequently they use it, the easier they feel it is. 98% of patients and their parents answered the image quality was good. 19% of them answered that sound quality was good. Nobody answered very poor in both qualities. 98 of them felt online speech therapy was meaningful. 96 of them hoped to have online speech therapy again. The reason a patient answers probably no is that their children could not consultate online training at home. 37 patients posted in the free text of questionnaire. Almost patients have some positive opinions. Online speech therapy could reduce their travel burden, time, and cost. Children could enjoy training because they usually play games with their computers or mobile phones. As negative opinions, one patient felt that face-to-face training is preferred. One dentist and one speech therapist participated in online speech therapy for one patient. They evaluated each of 53 patients. We considered the average score of a dentist and a speech therapist. 75% had good image quality. Low resolution breaking up of image distortion, and time lag affected it as a mechanical factor. As a human factor, we felt that the patient's mouth was not clearly visual and the patient was approaching the monitor. Others include interference of their brother, frame out to their movement, and dark screen. 81% had good quality of sound. Sound delay and breaking up of sound affected it as a mechanical factor. Others include echo. Human factors were brother's voice and life noise. We evaluated each patient's concentration. This is not comparison with traditional face-to-face training in our hospital. 68 of patients have training with high concentration. We rated online speech therapy is meaningful for 87% of patients. On the other hand, we have financial issue. We have medical insurance in Japan, and the patient usually pay about 13% of medical cost. Additionally, patients can use medical expense subsidy for children and have upper limit cost for a month. For example, in case of 3 years old, they only have to pay 600 yen per month. I took a questionnaire about the cost. How much can you pay online speech therapy? Almost patient parents answered less than 500 yen or between 500 and 1,000 yen. Medical consultation by telephone is approved temporarily. So once COVID-19 is over, we cannot use insurance medical treatment in our dental field, including online speech therapy. There is a big difference between how much a patient can pay and the actual medical intensive. The training were all able to be carried out smoothly without big problem. Evaluations from patients, their parents, and clinicians were also good from questionnaire. It indicates that online speech therapy is very useful for both. Online speech therapy have some benefits. We can reduce travel burden, time, cost for the patient and their family, and the risk of infection COVID-19. However, it has some barriers. We need to work out insurance system issue and protect patient privacy. I want to verify the therapeutic effects of online speech therapy and formulate a protocol such as devices and conditions in the future. We visit Vietnam and Myanmar to provide medical support and operate surgeries with local dentists every year. There are no specific special speech therapists in these countries. I would also like to support the development of speech therapists with using this program. Thank you for your attention.
Thank you very much, Dr. Tajiri. It's a very interesting presentation. Do we have any questions from YouTube viewers? Perhaps some of the viewers are also in the field of oral surgery. So the tele speech therapy is not covered by the National Health Insurance.
No, but the low cost.
Okay, so it's low cost, but it's not covered by the National Insurance. Do you have any difference of the patient compliance during the tele therapy than the actual face-to-face therapy? Is there any like the response of the children are better during face-to-face compared to the online one?
Almost the children enjoy the training by computer, and we can take a long time and more than face-to-face training.
Okay, so do you limit the time for each patient?
Yes.
How long per patient?
Minimum is 20 minutes, and long time is 40 minutes.
Oh, 20 to 40 minutes. Okay. Is there any other questions from other speakers to Dr. Tajiri? If not, perhaps we can conclude our session today. Thank you very much for all the distinguished speakers to share your experience, share your opinions regarding research during this pandemic situation. It's not easy, I know, and every country have their own limitation. United States, Indonesia, Japan perhaps have their own limitation and different situation that we have to deal with. And as an academician, I think our job is only to give our best in this pandemic situation, to teach as hard as we can and to do research in this difficult situation. Thank you very much. And perhaps at the end, we would like to have a commemorative photo. So please turn on your videos.
Okay, Yoshiko-san, can you turn on your camera? Okay, we can take a photo session at the last.
Mas Yoga, Dr. Agung ya? PDGI.
Okay.
Okay.
One. Okay, wait. I see. Yoga. 1, 2, 3. Okay, take one more. 1, 2, 3. Okay, thank you so much.
Thank you so much. And for all the YouTube viewers, thank you for your attention and thank you for joining us. This is our 50th APAN event, Telemedicine Asia Pacific Advanced Network. So next time we will have another session and please join us with different topics. Thank you very much and see you.
Thank you very much. Bye-bye.
Bye. Take care.
Thank you. Bye-bye.
Thank you. Stay healthy.
Stay
Stay
safe.
healthy, stay safe.